So, look at a fascinating topic this morning, and this topic is all around the concept of kidneys and hypertension. That's like, does kidney actually have a role to play in somebody having hypertension? Or if you are going to cure someone of hypertension, should you focus on the kidney? So this is just the introduction. So these are the different functions of a kidney, and it's all around trying to put out extra fluid and also extra waste. Of course, waste can be extra. Okay, so just put out waste. So the kidney plays a central role in hypertension. This is because they regulate a lot of things in the body, including the blood volume and the sodium balance. You know, so the kidney has hormone systems like the Renin, Angiotensin, Aldosterone system. So all in all, it helps to actually regulate sodium and water levels in the body. So how does kidney contribute to hypertension? For sodium and water regulation, healthy kidneys will filter blood and excrete excess sodium and water. So if the function is impaired at all, it leads to what? Fluid being kept back in the body. Blood pressures are also raised. They also have the renin angiotensin aldosterone system, where kidneys will release renin when they sense that there's a reduced blood flow, so that there's vasoconstriction, which is caused by angiotensin 2. And sometimes, if the renin angiotensin aldosterone system is overactivated, it leads to hypertension that is persistent. So, sympathetic nervous system activation now. Decreased kidney stimulate diseased kidney will stimulate renal nerves. This will increase adrenaline release. So the raise vascular tone and it will raise vascular tone and it will also raise blood pressure. Okay. There's also endothelial dysfunction. A damaged kidney vessel will reduce nitric oxide production. So arteries will stiffen and they will lose their ability to relax, to be flexible. So this actually worsens hypertension, so to say. Hypertension causes it. It also worsens hypertension. You see hypertension related renal complications. Okay. So that's what we have. So how this hypertension damages kidneys is arterial narrowing. So there's scarring of the blood vessels, and narrowing of the blood vessels. So the oxygen supply is reducing, So there's also the glomerular injury where delicate kidney filters scar and leak proteins, right? So there's proteins in urine. So over time, it progresses to chronic kidney disease if it is not treated. So cycle of damage, you should know that what kidney disease causes hypertension. Hypertension also worsens kidney disease. So clinical implication is prevalence. Nearly half of adults having hypertension usually is to have kidney disease. The markers of kidney damage is what the glomerular filtration rate is actually reduced, and there's proteins in urine, that's proteinuria, and there's edema. So swellings in the legs, swellings in the feet, swellings in the face. Okay, they are all markers of you know kidney disease. So management have to do with lifestyle. You have to reduce the amount of salt you are taking and control your weight and cease smoking. Then medications, you give all those angiotensin converting enzyme inhibitors, angiotensin receptor blockers, you know, and diuretics so that to reduce the fluid, and combination therapy, you always mix the drugs and all of that. Then you keep monitoring the blood pressures of the person, the glomerular filtration rates, and also what albuminuria to see how the person is recovering from the condition.